You gotta get up top, get both shoulders over the patient's body, and push down. See how I'm moving that entire set? This is not gonna pump any blood. Welcome back to the channel. Today we are reacting to NBC's new hit comedy, St. Denis Medical. St. Denis Medical is a sitcom about an underfunded hospital that takes place primarily in the ER. And I am gonna watch it and figure out how realistic this show is.
Okay, got your packed lunch.
Oh, thank
Some
you,
treats
ma'am.
from the vending machine on me.
Yeah.
Okay, first of all, treats from the vending machine on me never happens. Sometimes when you get discharged, if you've been nice, we will give you a little something extra to go home with. Like a turkey sandwich, some crackers, maybe a few juices. But we're not spending our own money to go to the vending machines to buy you anything.
If you are gonna use it again, as a nurse, I have access to some really good stuff and I will hook you up, okay?
Yeah. Let's do that.
No, man.
No.
That was a test. See?
Yeah.
That's what you can't do. Get your stuff. Let me get your chair and get you out of here. You want to rehearse it again?
I didn't know we were
Do you
gonna
want
be...
some drugs? And you say, no.
No, but I didn't expect you to say that.
When I was a kid, I really wanted to be a doctor. And then when I was in college, my nan got sick, so we spent a lot of time in the hospital. And that's when I realized that the nurses really provide the care part of healthcare. So I became an RN.
That sounds like every nursing school essay application ever. Why did you decide to become a nurse? Well, my grandma got sick really one day and I went to the hospital and I saw that it was actually the nurses who take care of her, not the doctors. Classic. Oh my God.
Every now and then a moment comes along where you truly change someone's life. And that's beautiful. Mr. Flynn, those are supposed to open in the back.
I don't want you to see my tushy.
Yeah, all the time. Those gowns are very confusing, to be fair. If it's the first time you've had to deal with it, it makes sense that it would open from the front, but they actually open from the back. And that is because when you're laying down on the hospital bed, it's easier to lift it up and just check your body. If it was the other way around, first of all, it wouldn't make sense. It's also easier, if we need to check your butt, because most of these patients are immobile, incontinent, which means they pee and poop in the bed. It's much easier to clean them when you can get to your back easier. I've wiped a lot of butts in my day.
Cool. What is it that I always say? What's the most infectious thing in a hospital?
C. diff?
No.
Antibiotic-resistant staph.
No.
I think it's pneumonia.
No. You guys, the most infectious thing in a hospital is a smile.
See, this is the difference when you ask an executive director what the most infectious thing in a hospital is, as opposed to actual healthcare workers who are on the floor. They would never say a smile. They know that it's actually a disease. Unlike the executive director, they need money. She said it right from the beginning. She needs funding. So this is classic problems that happens at every hospital. Executive directors, their job is to save the hospital money and to get the hospital money, right? They're not really thinking about what's happening on the floors. Like you saw all the stuff that was happening at the beginning of the show. Patients smoking in the chair, chips falling on the ground, grandpa walking around with his penis hanging out. They're not thinking about that stuff. They're thinking bigger picture. What can we do to make this place more efficient and save money? They're also good at
12 seconds later.
presenting why this hospital is great, not exactly why the hospital is a terrible place. So, of course, what's the most infectious thing? A smile. And that's what happens at St. Denis. Meanwhile, in the back, St. Denis is on fire.
So apparently, I ordered so much Postmates last month, they sent me a gift card.
Sweet. Sad. That's a sad thing.
Again, classic problem. We deliver food all the time. When you're working night shift at the hospital, the cafeterias aren't open. Isn't that f***ed up?
That's gotta be illegal.
Most hospitals have no way of providing healthcare workers food at night. So we're either eating junk food from the vending machines or we are stealing food from the hospital pantry. I cannot tell you how many times I have eaten a turkey sandwich at 3 in the morning.
So I got a promotion, and so I am officially a supervising nurse. Came with a small pay bump and a large responsibility bump. So it's been a little difficult finding that work-life balance, but it's good. It'll be good. It'll be good.
You would be surprised how little more you get paid for becoming either a charge nurse or I guess a supervising nurse. It is as little as like $1, but the responsibility is You know, and people do this because it is a stepping stone to what they want to become, like a manager eventually. I don't think you become a charge nurse because you want to become a charge nurse. Most of the time, you become a charge nurse because the hospital needs you to become a charge nurse or a supervising nurse because they're so short-staffed, in my experience. If you're a healthcare worker out there, let them know in the comments, okay? How much did you get paid going from a regular floor nurse to becoming a charge nurse?
Give yourselves a pat on the back.
I don't understand why you're letting everybody else in, and I'm just
I
sitting there.
understand. I hear you.
You know something? I need
I
to
need to
see
check
a
into the
doctor
nurse's station.
now.
Pause. It's a priority-based system, and my leg hurts. Does not get seen before my spleen exploded.
Well, my spleen hurts too.
Ma'am, where is your spleen?
Well, it's where the spleen is. You should not, like, right in this area. I mean, and sometimes it comes and creeps over here.
Nice try. Have a seat. Next in line.
I'm new today. and
Next in line.
I'm not like injured or anything. I just
Good.
need...
Then you have no problem walking to the back of that long line of people who are following the rules. Next in line. Sir, how can I help you today?
Late on my first day, not ideal.
The waiting room, it is normally that chaotic, but nobody's really waiting in line like that. I mean, there's usually chairs. If you're coming to the ER, not that many people are standing. People are complaining. That is a classic situation where the woman's like, well, you know, I'm in pain too, and she's trying to make her pain more painful than the other person so she gets seen quicker. The ER is priority based, so they did get that right. An exploding spleen takes priority over my leg hurts. What doesn't happen is if you're a nurse on your first day and you walk in with regular clothes. You're walking in with scrubs. Rookie mistake.
Great, okay.
Oh.
I think the whole system just went down.
Did we just lose everything?
Joyce, our computers are too old, okay? They need to be replaced, not just fixed.
Look, we just don't have the money right now for a whole new computer system.
But we have money in the budget for your fancy 3D mammography machine?
Did you hear that? We don't got money for new computers, but we definitely have money for whatever you think is necessary to draw more money to the hospital. Sometimes this does happen, but when the system goes down, it's because we plan for it. There's certain times out of the year, maybe like, I wanna say like once a month, where we call it downtime in the ER, where the systems do shut down and we have to chart everything for about 2 hours. It usually happens in the middle of the night when there's the least amount of patients in the ER. And I think it has something to do with people in the back having to like reboot or fix some problems or do some updates with the system. So there are times, even today, where there is at least a few hours during the night where everybody is paper charting everything, vitals, chief complaints, and then when the system comes back on, we have to go in, backlog everything that we've done. It's never been because a $300,000 mammography machine.
Alex, I checked in with all the patients like you asked.
Great.
And Mr. Lasky wants morphine, oxy, and Vicodin. He asked if we had a menu, and I said I didn't think so.
Okay. I will check in with Mr. Lasky. Thank you.
All right, well, I'm around. Let me know if you need anything.
Okay, so classic new nurse is willing to give the patient anything they want. Did you see the list? What was it? Morphine, Vicodin, and like one other thing. I forgot what the last medication was, but of course we're not giving him all of that. And the patient asked for a menu? No, you're not getting shit. You're getting nothing. You're getting Tylenol. That's what you're getting. Ibuprofen, all right? Suck it up.
Babe, you coming?
I'm so sorry, honey. I'm trying. It's a disaster here.
Listen, the girl playing the lead got sick, and Ella's the understudy, so she's Donna.
Oh my God, she's freaking Donna. She's Donna. Wait, she's Donna.
Yeah, so are you gonna make it?
What? Yes, tell her that I'm coming. I'm gonna leave in 2 minutes, okay?
Okay.
She's Donna. And Mamma Mia.
What usually happens in the ER like this is there's always gonna be work to be done. From 7 a.m. to 7 p.m., that's usually a shift. The morning shift usually starts off really slow and gets crazy busy from 12 o'clock beyond. And by 5 o'clock, 6 o'clock, when it's time for you to leave, that ER is on fire. I mean, it is the busiest time. So that shift change from night shift to day shift, when they're coming on and day shift is getting off, that handoff is usually crazy. For her to try to leave early when it's close to the end of her shift is probably impossible. It's the busiest time in the ER. Night shift, they get on, everything's on fire, they go crazy fast, and the first 4 to 5 hours of their shift is probably the busiest. After about 12, it slows down, and from 1 o'clock to 6 a.m., chill.
Okay. I've done a lot of these before, usually with someone supervising, but that's fine. It's just a quick stab. Oh, sorry. Take 2. Here we go. Just quick stab in the leg. All right, 3, 2, 1, stick. Okay. Wrong side. Got myself. That's intense, huh? You okay?
I feel like I need to go to the hospital.
So we just need your autograph.
Oh my God, he stabbed himself with the EpiPen! This would never happen in the actual ER because we're not using EpiPens in the ERs. If you're a patient, you're getting an IV, you're getting epinephrine put into the IV. We're not sticking you with a EpiPen. That is unrealistic.
Ma'am, are you okay?
I will be, when I can find a hospital that doesn't suck.
Oh no,
Okay.
something's wrong with her.
1A?
Yeah.
Mac at the door.
Yep, she's unresponsive.
Her breathing's really shallow.
Turn IV wide open.
Get her on the monitor right
Jesus.
away. Yep. We need some doctors in here. Call Code Blue Respiratory.
Yep.
How are we doing?
Code blue. Code blue.
Starting
We got a
compressions?
Code blue in here.
Matt, use the intercom!
Is there a button I'm supposed
But the question is something I've never used one of these before.
Hey,
Yeah, so calling a code blue, there's usually a button on the wall of every room where you could just press. And the rapid response team will come down and help out. A rapid response team is a team of 1 or 2 nurses and a respiratory therapist who are waiting around in the hospital specifically for emergencies. Also, not how you do CPR. That looked terrible. I don't know if anybody saw. She was doing CPR like this. Like, what is this? You're not gonna get proper depth or pressure like that. You gotta get up top. Get both shoulders over the patient's body and push down. See how I'm moving that entire set? This is not gonna pump any blood. Not realistic. Cutting the clothes off, very realistic. They actually look like actual trauma shears. And also, like, they're bringing the patient on a stretcher through the hallway. It's an emergency, can't be that big. If you're coming through there and things are bad, everybody's gonna know. That room should be filled immediately.
She fell and
What's
is
happening?
old,
Collapse in the parking lot, shallow breathing, hypoxic, 83%, we lost her pulse.
she was in the waiting room. She said her leg hurt.
Sounds like DVT turned pulmonary. Let's get some heparin in here.
Sounds like a smoker. Could be pneumothorax.
It's an embolism, Bruce.
I think it's both.
I'm guarantee you it's both, not guarantee. But what it sounds like, she had a blood clot in the leg, which is why her leg hurts. The blood clot broke off, went through the bloodstream, hit her lungs, and now she's having a pneumothorax.
So a blood clot in her leg triggered a pulmonary embolism, and that in turn caused her lung to collapse.
Which is pretty rare, but it happens.
Yeah.
He's saying it's pretty rare. I don't know if it's that rare. I feel like I've seen it a few times.
Sir, I am not in the mood to be assaulted by a stranger right now. It's...
They told me that you're the one that saved my Lori.
Oh, your wife. Yes.
Thank you. Thank you.
That was nice how it ended. The family member of the patient that was saved comes and hugs the healthcare provider. It happens sometimes in the ER. Think about it, okay? The emergency room is a place where we stable patients, keep patients stable. If they're really in a life-threatening situation, the ER stabilizes them, and then they go upstairs to surgery or whatever else they need. They're probably going to the ICU. It takes time for people to get better. Rarely do you see someone just come back right away like that. A lot of the thanks goes to the nurses who aren't in the ER. That was nice. Good episode. It's funny. I like it. Is it realistic? I think so. They got a few things right. They got a lot of things right. The dynamics between executive directors, nurses, doctors, surgeons. I would have really liked to see a respiratory therapist. I don't think those guys get highlighted enough. Throughout the episode, there were no ER techs. I saw some EMTs, the guys with the white shirts and the walkie-talkies, but no ER techs, which is kind of a bummer. But at the same time, I understand. I think what people don't understand is that a hospital, an ER, is much more than just doctors and nurses. I'm an ER technician. I didn't see an ER tech. We didn't see a respiratory therapist. I think in the future, it'd be nice to see those characters. A social worker, definitely. You have to have a social worker in the emergency room. CNAs, volunteers. We have nursing students, x-ray techs who are walking around with x-ray machines. There's all kinds of people who walk through the ER. So hopefully in the future, we're gonna see more of those guys. But overall, love the episode. So, what'd you guys think? Should I react to another St. Denis Medical episode, or is there another show that you want me to react to see if it's realistic or not? Let me know in the comments. I'm currently on tour right now. Dates and ticket links are in my bio. I hope to see you at a comedy show. Thanks for watching, motherfuckers.